Hey everyone, welcome back. A bit more time on foot pronation. So revisiting this concept of a high arch, remember that the high arch is driven by several factors. What we need to do is recover the ability to dorsiflex, internally rotate at the tibia, internally rotate that lower leg bone. That's going to help drive calcaneal eversion. We're going to tilt that foot, that rear foot in. As a result, that's going to help collapse the arch of the foot into true pronation and begin to even invert a little bit, relative inversion at the mid and forefoot. So when all of that happens together, we're going to get a healthy functional pronation. Two more ways to begin working on that. Okay, this first technique is a mobilization to help begin prepare the foot for calcaneal eversion, and as a result, the first phase of foot pronation. So I'm just going to take the heel of my left hand. I've crossed my right ankle over my left leg. I'm going to take the palm of my left hand, put it on the inside of the heel bone. I'm going to secure the rest of the ankle with my right hand, and I'm simply going to push down on my heel bone. So I'm attempting to kind of slide my heel away as I press down. So again, I'm attempting to distract a little bit as I press down. I'm not just going to press straight down. I'm attempting to push almost in a diagonal direction. Hand is placed on the inside edge of the heel. I'm distracting and pressing down. So we're working on that subtalar joint. We're working on calcaneal or heel eversion. You'll want to do this at least 15 or 20 times in preparation for the next exercise. Now we're going to begin to recreate healthy functional foot pronation. I'm going to use that using wedges. You don't need to buy wedges. They are on Amazon. They're really cheap. I can send you the link if you want me to. You can also use a rolled up washcloth. Under the correct foot contacts, that will be just fine. So remember that the first thing we need to do, we have already worked on our tibial internal rotation. So the first thing we need to do for the foot is make sure that we get the heel bone, the calcaneus, to evert. The midfoot and the forefoot needs to begin to invert. So to begin creating heel bone eversion, to get that heel bone to begin to tip inward toward midline, we're going to take one of these wedges and I'm going to put about half of my heel on that very narrowest edge of the wedge, at the very end of the wedge. So half of my heel is on that outside edge of that wedge. Now I'm going to take the other wedge and I'm going to put just my first two toes on the very end of that wedge. Now that I've got the foot contacts in place, I can begin to play around with foot pronation. I'm going to take my other foot, I'm going to put it behind in almost kind of a half lunge, foot is pointing out to the side. Now what I'm going to do is, most of my weight is on this back leg. I'm going to drive my knee forward, keeping most of my weight through my heel as long as I can, keeping the midfoot and the forefoot very soft and relaxed. I'm going to drive that knee forward, and then the knee is going to come in just a little bit right at the end, just over the big toe. I'm not going to dump it all the way in here. That's not going to help out. We just want to come as far forward as we can and bring that knee just over the big toe. As you do that, you will feel that arch begin to collapse. Work on creating that sensation that the forefoot is relaxed all the way through this motion, forward and back. You may want to do this as many as 15 or 20 times. This is a very gentle, easy movement, and it will take, if you've had a rigid high arch for some time, it will take several repetitions for you to begin to feel that midfoot and that forefoot begin to unlock in this movement pattern that you probably haven't experienced for some time. So that is how we begin to get back our ability to pronate through the foot. If you have any questions, please reach out. We'd love to talk to you more about this. We'll see you again soon.